Thanks everybody for joining us today. For those of you who joined on the phone, in case you haven't already, there is a link in an email we sent out this morning to the webinar so you can see all the screens and see all the slides as well as we go through the presentation. So if you haven't done so, please find the link in your email. It was sent from me. This is Nikki Yates. And click through, and it just takes a minute to sign in as a guest, and you can join our screens and see what we're talking about as we go through. At this time, I just want to take a second to introduce Caitlin Thompson from the Veterans Crisis Line. She's going to share a little bit more about what the VA is doing and the Veterans Crisis Line. I'm going to hand it over to her and let her kind of finish off from here. Caitlin, are you still with us?
I am. Hi, everyone. Okay, so it's really such a pleasure to speak with all of you today, and I'm really looking forward to to meeting those of you who will be at the Crisis Centers Conference at the end of the month. Please make sure that you come introduce yourselves to me, and I'll try to do the same. But really excited about the connection and the collaboration that we have at Lifeline. I'm going to spend about a half hour or so just going through just a refresher on the Veterans Crisis Line and what we're doing now, what has changed potentially since you last heard about us, and then also talk more about how you can access us if you ever have a veteran on the phone or a family member or friend who's on the phone. I don't have access to the Adobe thing, so I'm just going to be saying next slide as slides go on, and Jessica or Nikki is going to forward them. But I want to just start in this first, the cover of the title page of the presentation, because I wanted to first show everybody the new branding of our crisis line. And incidentally, I'm also looking forward to a lot of questions at the end here, which is why I want to kind of get through these. I'm sure you'll all have a lot of questions. So we were the Veteran Suicide Hotline, the Suicide Prevention Hotline, and in the last few months or so, we've done a total rebranding to the Veterans Crisis Line. And our kind of main statement is, it's your call. The reason for changing it from the Veteran Suicide Hotline to the Veterans Crisis Line, there are a couple of reasons. One is that veterans tend to be less inclined to reach out for help, and especially when the word suicide is in the title of the place that they're going to reach out for help, they may be less likely to do so. So we changed it for that reason, and we also changed it so that just like many of your crisis centers, we're trying to reach people before they actually become suicidal. So when they're in crisis, we want to grab them and really try to connect them with services so that they don't get to a point where they're feeling suicidal and needing all those further services. So anyway, there will be a lot of swag, I'm sure, in the next few months and that you'll be seeing, and a lot of advertising that will be done across the country using this new branding, Veterans Crisis Line. Okay, next slide. So the overview of the presentation is I'm going to be talking a bit just about veterans and suicide and the differences between veterans and non-veterans and suicidal behavior. I'm going to talk some about some risk and protective factors about suicide in veterans. And then I'll be talking about our Veterans Crisis Intervention. So I'm going to include the Veterans Crisis Line and the Veterans Chat Service in that part of the presentation. And then I'm going to talk about how to specifically connect to our crisis line if anyone on your teams have veterans who you feel like they would be perhaps better helped by those of us within the VA system who can really connect them with services that are specifically for veterans or family members or friends of veterans. Also, I'm not going to go through the chat service so much just because one of the presentations at the Crisis Centers Conference will be specifically on the chat service, but I'll definitely get through parts of that too. Next slide, please. Suicide in veterans. At this point, as we all know in this field, there are between 30 and 32,000 deaths by suicide a year in the general U.S. population. And what they've found more recently, is that 20% of those are veterans. We found that really in the last couple of years, there are about 18 deaths by suicide a day, specifically by veterans, and about 5 deaths by suicide a day from veterans who receive VA services. VHA is just short for VA services. Veterans are far more likely to use firearms than non-veterans, and we have what are called suicide prevention coordinators. And this is a very unique piece of our crisis center compared to all of your crisis centers, is that, and it's really a luxury for us, is that we have this huge, overwhelming ability to link to local VAs. We are able to access all veterans' medical records from our little spot up here in Canandaigua, New York, and so we're then able to really connect people to their local services. Again, at the same time, though, we are a national hotline, and we're just based in this little area of Canandaigua. I know that most of your crisis centers are local, or specifically local crisis centers, but this is the way that we're then able to connect people locally. The suicide prevention coordinators, there is at least one to a team of suicide prevention coordinators at every VA across the country. So that's at least 150 across the country. There are about 150 VAs across the country. I'll be getting into a little bit of what they do and how we connect to them later, but one of the things that they do is tracking. And they've found recently that there were about 1,000 suicide attempts a month by veterans who are receiving care in the VA. So these are pretty extraordinary numbers. Next slide, please. Overall, the research that's been done on veterans and non-veterans, it's been found that veterans are twice as likely to die by suicide compared to non-veterans. And in a depressed VA treatment population, so for veterans who are going to a VA for treatment of depression, those rates just go even higher to being about 7 to 8 times greater than the rates of the general population. And there was a recent study that came out that also found that female veterans are about 3 times more likely to die by suicide compared to the general female population. So again, just really extraordinary numbers. Next slide, please. I want to just go through some characteristics of suicidal veterans compared to non-veterans. So just the things that we at our VA hotline watch out for in particular is, first of all, old age. As most of us know, those individuals who are older in age tend to have the highest rates of suicide compared to any other age population. Well, our Vietnam veterans are certainly getting older, and they still tend to be the highest population of war-era veterans. The World War II veterans are still around, but they are dying. About 1,000 World War II veterans die a day. So that population is continuing to get smaller, but the Vietnam population continues to get older. And again, as most of us know, usually individuals above 65, but mostly above 75, tend to have very high rates of suicide. So white older veterans tend to have high rates of suicide compared to non-veterans. Those who've never been married, those with low social support, medical and psychiatric conditions, for whatever reason, and they haven't been able to really get into this yet, but more than 12 years of education tends to be a risk factor or characteristic of suicidal veterans, firearm availability, and impaired functional status. And as many of our responders and veterans can attest to, the veteran population tends to be a pretty multi-problemed population, and that includes a lot of physical injuries, a lot of psychiatric problems, high rates of substance abuse. It tends to have a lot of isolation, and isolation, of course, in older men tends to really be one reason why there are such high rates of suicide, as well as just such a desire to do it and the use of guns. Next slide, please. So what is the VA doing as far as suicide prevention goes? The VA's main focus for suicide prevention is ready access to high-quality mental health and other healthcare services. So when you next see any of our PSAs that are coming out anytime soon, besides "It's Your Call," you'll be hearing the two words "treatment works." We're trying to use that, especially for our veterans, is that treatment works. You can get better. You can feel better. And so we want to get people into care as quickly as possible to lessen any further suicidal thoughts or feelings that they may have. This is supplemented by programs designed to both help individuals and family engage in care and then to address these suicide prevention in our high-risk patients. Next slide, please. One of the ways, there are a lot of different ways that the suicide prevention efforts have been made across the country for veterans, and one of those is our Veterans Crisis Line. And I just want to go through a little bit of history with that. The first call came in on July 25th, 2007, which is when we went live. Prior to this date, there were no other crisis intervention services specifically for veterans ever. So for those of you who have been in the field for longer than the last 7 or 8 years, can probably attest to the fact that you were getting most of these calls from veterans and perhaps didn't know the more specific needs that these veterans had and how you could kind of connect them with VA services. And so it's really lovely that this has started out, and so that we can collaborate with all of you and your local crisis centers and helping to really transfer some of those veterans over to us. As I said before, we're based in Canandaigua VA Medical Center. Canandaigua is just this lovely little town on Lake Canandaigua, which is one of the Finger Lakes up in upstate New York. And we have a partnership with SAMHSA and Lifeline, and we started out with 4 phone lines and 14 responders. And if you go to the next, well, no, I don't have that next slide, but I can tell you, we're still at slide 7, I can tell you now we are up to 19 phone lines and we have about 140 or so responders. So the numbers have just really gone up quickly. We have a full staff of about 160 people. And on our staff includes, as I said, just about 140 or so responders. So those are the people that pick up the phones. Then we have about 20 health technicians who are on every shift. And our health technicians kind of sit in the middle of the call center, and they are available to, when we're on the phone with somebody who may be in significant crisis, we need to get emergency services out to him or her, then we grab a health technician who then manages working with the paramedics, working with the police. And so this is a real luxury for us. I would imagine that not many of your crisis centers have that amount of help and that luxury, and so it's really a gift. We have at least 2 shift supervisors on any given 3 shifts. We're a 24/7 operation. And at this point, I'll get into numbers, but I can just tell you right now we're taking over 500 calls a day from around the world, and so we're actually feeling pretty strapped right now. I know I'm probably preaching to the choir with this group, but it has been a pretty our numbers have really gone up pretty significantly in few weeks, in fact, and I'll talk more about those in a bit. Okay, next slide, please. So what happens when the calls come into our crisis line? And yes, this is probably going to sound familiar to all of you. You know, we conduct a phone interview. We use the assist model and the lifeline model. So all of our clinicians, all of our workers have been trained in both assist and the lifeline model. Um, all of our staff are paid government employees, and pretty much all of the staff have come in with some level of mental health background. Most have advanced degrees, master's degrees, addiction specialists, nurses, social workers, and a couple of PhDs are on the line as well. So we go through a phone interview. We assess emotional, functional, and psych conditions, and then, of course, we assess the severity of the call. So the way that we construct how severe the call is, we have the emergent issue, so emergency services are sent out. At this point, out of the 500 or so calls, we send out about 30 to 40 kind of rescues a day. And again, this is to all over the world. We've done rescues abroad. If you ever have an active duty service member who's calling and you need help in terms of finding the person, you can give us a call. We work with both active duty and veterans. When you press 1 and when you call your lifeline number and you press 1, when it says press 1 for, it'll say press 1 for active duty service members and veterans and family or friends of active duty service members or veterans. So so we do that. Our urgent is trying to get them into services at their local VA, so same-day services. And then our more routine is an SPC consult, which I'll talk about in a second. And then the informational is, just talking to the person. As do you, we have our extreme share of prank callers, our repeat callers. We have a whole protocol that we've set up for our own repeat callers. And the beauty of doing that with the VA is that I then, whenever we have a caller who's calling excessively, I can call the SPC, the Suicide Prevention Coordinator, at the local hospital and work together with that person and the caller's treatment team in order to assess what the best way is to handle, to best manage that repeat caller. And so that's really a luxury. And we've taken the Lifeline model of about, we have one call a week for 10 minutes at a time, and it's really lessened those calls from those callers who are needier, but not necessarily in crisis. And it tends to shape the behavior pretty well. Which can be just really a relief for our staff, and also, as we know, it's just not very therapeutic for these repeat callers to just call back over and over and get 140 different people at any given point. So informational talk and information provided. I want to get to the consult. Next slide, please. So we're at slide 9. A consult occurs if the veteran consents, and this is where we link the veteran to their local services. And this is one thing that when you're talking with a veteran at your crisis center, you can kind of think about whether or not you feel that they're getting the right services. Are they even connected to the VA? A lot of, it's about 40 to 50% of veterans actually have no affiliation with the VA, even though most are could be enrolled in VA services and get a lot of care. So if that happens, you can connect them with our crisis line, and we can then link them to the person who can help to get them enrolled in VA services, talk about what's called service connection, which is there's a percentage if you are in some way injured or you have PTSD from combat experience, or for instance you lost an arm during combat, then you have a certain percentage of service connection that you get, which is equivalent to both money and services. So these are all benefits in really working together with us so that we can work then with the veteran and get them into the VA and get them more services than they may be getting. So the consult is the way that we do that. If the veteran, though, says, you know what, I don't want anything to do with the VA, I have had it with my VA, and we hear that a lot, and that is fine. We still want to be a crisis line where veterans can call and know that we understand their needs as veterans or service members. On our staff, about 30 of our responders are veterans themselves. We also have veterans who are health technicians, and we actually have a couple of active service members who are also responders too. So I think with veterans, I think that they're calling so much because there is an understanding. It's a veterans crisis line. So many times when you talk with veterans, they will say things like, well, nobody really understands except for my buddy from Vietnam, or my tent mate from Afghanistan. There's such a connection that they have with their fellow soldiers, and I think that that's one reason why people seem to be reaching out more. So what happens with the consult? This consult for the SPC, and again, SPC is Suicide Prevention Coordinator, and that's the person or the team of people that's at every VA across the country. It alerts the SPC to the veteran, to their needs, and they don't have to be suicidal. We can connect them for pretty much any reason at all, and the SPC, even though we'll say we can connect you with somebody called your Suicide Prevention Coordinator, the veteran may then say, oh, I'm not suicidal. Then we'll say, no, it doesn't matter. This is just the name of the position, and they'll be able to help you in whatever way you can. Even if the veteran already is connected to treatment, this consult can be done to let the SPC know that there may be changes in the veteran's circumstances or any other needs. Next slide, please. So the consult happens, what happens is the responder will get the okay from the veteran to send a consult. The consult is then sent electronically to the specific suicide prevention coordinator. We have a pretty elaborate system, software system that all the SPCs and we all are connected to. And then the SPC, the Suicide Prevention Coordinator, is required, mandated, to call the veteran back within 24 business hours. Many times we will have veterans who call us and say, I haven't heard from my provider in the last 4 months. I don't know when my appointment is, blah, blah, blah. And we can confidently say, listen, we can have somebody call you back within 24 hours, and they will call you back. After they call to set up an appointment at their local VA, they can meet with the veteran for evaluation, enrollment, or other services, and then the SPC then can contact all necessary professionals to better coordinate care for the veteran. Next slide, please. We're at slide 11. So what happens then? The veteran may be brought in for services at the VA. They may be assigned a provider or treatment or reconnected with a provider or treatment team. The veteran may refuse an immediate evaluation, which is fine, and the SPC will hopefully continue to do outreach. There may be a welfare check, so they, even from the SPC's perspective, perhaps they're concerned about the veteran's living conditions, so they may send somebody out to just put their eyes on the veteran, or the veteran may be educated about other ways to get their needs met. Next slide, please, slide 12. So this slide is a little busy, but I just want to look at it for a bit because I think that it really is showing how much our crisis line is expanding and how many calls are coming in. Let's look at fiscal year 9 totals, which is the second to bottom line row of the graph. So the total in that year was we had about 119,000 people call us, and out of those about 64,000 were veterans. About 7,500 were family and friends of veterans. At that point we did about 3,700 rescues, and of those callers about 1,590 or so were active duty. And then if we look from at the very top line for October of last year, so it's fiscal year 11, so October of 2010, and you compare the numbers even from October to June, you can see we have really increased in terms of our numbers. And there are a lot of reasons for that. I think that there's been a lot of a lot of branding, a lot of the PSAs have been coming out, a lot of men and women are coming home. What I've recently heard is that out of all of our calls, about a third of our callers are from Vietnam era, about a third of our callers are from the Iraq, Afghanistan current era, and about a third are other. But those numbers are really going up. So we've had about 15,262 calls last month. 9,200 were veterans. 1,200 or so were family and friends. You may be getting calls from family members or friends who say, I'm really worried about my husband or about my father or about my daughter. And if you can definitely connect those people with us too, because we would be able to help them with getting services for their father or mother. We do third-party reach outs. So if somebody says, I'm really concerned about my father, he lives across the country, he doesn't sound very good, we will then just reach out and call the father and see how he's doing. And then in June we had about 616 rescues and about 179 active duty service members. So I can't hear your reactions at all, but I'm curious about what your reactions are to these numbers compared to your crisis centers. I'd imagine that they're quite a bit larger than your crisis centers, but then we also have to remember that we have a staff of 150 people. So and we also have government funds. And so whenever I talk with a lot of you and we talk about the struggles, I think that we as crisis centers have a lot of very similar struggles. At the same time, I think that we have a bit of a luxury in that our funding is pretty well intact, because there is also such an important focus, as there should be, on veterans and suicide, though I, of course, think that there should be more of a focus just in the general population about suicide and crisis centers. But this is the Veterans Crisis Line is, for better or for worse, seen as a bit of golden child in the VA system. And I think the main reason for that is because, as you see in the numbers, people are reaching out. And the question is, why are they reaching out? And we're really starting to look into that more. Okay. Let's go to the next slide, slide 13. So I'm just going to run through a bit about the Veterans Chat Service. As I said, I'm going to do a full presentation with Shai Lewis at the end of the month at the Crisis Centers Conference, and I'll be presenting on our chat service and getting into much more detail. And then Shai will present on what it's like for them to be our backup center, one of our backup centers. So looking forward to that, and then we can really talk more about the chat service. But just a bit of an overview. So our chat service, veterans, families, and friends anonymously chat with a trained VA counselor. And if the chats are determined to be crisis chats, the counselor can transfer the chat visitor, over to the suicide hotline, to the Veterans Crisis Line. I should have changed that language. Challenges with the chat service for the VA, there are quite a few. It took months and months to finally get this thing up and running because of the fear of security and confidentiality of veterans and electronic security issues. So they finally allowed us to start a chat service as long as we had we didn't save any electronic records or transcripts on each of the chats. So the transcripts, we print out a transcript on everyone, and that's the only data that we have, the only evidence that we have that a chat ever existed is the hard copy printout that we keep locked up here. And so that's one of the challenges, is we can't kind of go back and find things easily, if somebody came in before. Another challenge for those of you who are starting up your own chat service, or who have had a chat service going, and you can speak to this, I'm sure, as well, but another challenge is that whereas with a phone service where you have a phone number, we can't look down and see exactly where the person is, or give someone really it's just the server address, and say, find this person, they're at imminent risk right now. we can't do that with a server address. If I was writing in to the chat service from my computer up here in Canandaigua, it would look like I was in Washington, D.C. because our VA servers are in Washington, D.C. So that's one of the big challenges. Other challenges we can talk about if you have any questions about those at this point, but then we can also talk about them at the end of the month. Next slide, please. So we're at slide 14. So for our chat service, and check out the New York Times on Sunday because I think they're doing a whole thing on it. So rock on. I'm wondering if anyone's alerted you guys to that, but I guess I'm alerting you to it now, especially to the National Lifeline folks. We can talk about that offline later. But yeah, so the New York Times is going to be presenting some information about our Veterans Chat service. The service began in July of 2009, and this is a one-to-one chat with a counselor, and really what it is an access to care for those who prefer internet versus phone. So this is for especially our veterans and our service members who are scared to be found out that they're struggling. We get a lot of chats that come in from tents in Afghanistan where the soldier is saying, I am sitting here, my buddy is right next to me, but I don't want to call because I don't want anyone to hear that I'm struggling. I'm really having a hard time here. I don't know what to do. I don't know who to reach out to. And we can then provide that level of support for the soldier over online without them, first of all, without them letting us know who they are, but also without them having to talk on the phone and be known. We've also had people who chat with us who say, I'm asleep right now, I'm not asleep. My wife is asleep next to me right now, and I'm just really struggling with PTSD symptoms, but I don't want to let her know. This is a way that they can reach out for help without having to talk to anyone on the phone. We do have this pretty elegant system where if we're really concerned about them, or if we feel that the visitor, the visitor who's coming into the chat service, if we feel that they could benefit from a consult, we could ask them for their phone number. That's the only identifying information that we're allowed to ask them is for a phone number, and then we can have one of our hotline responders call them back. And this continues our partnership with the Lifeline Crisis Network. We have a wonderful relationship with our backup centers in Rochester as well as San Francisco, and we're very excited that we're going to be getting a third backup center, and that's going to be with Boys Town in Nebraska. So really excited to start that partnership as well. Out of our staff of 150 or so, about half of them are trained chat responders. For us, it's voluntary. I think that for those of you who do chat know that it takes more special skills to be a chat responder as opposed to a hotline responder, though those can definitely be taught. But for people who get very anxious about not being able to find someone if they're at imminent risk, the chat might not be the best place for them. But we certainly, as supervisors, really watch out for those issues that may come up in chat. Next slide, please. So here's the quick link to basically what is the Lifeline page. Next slide, please. So you've all seen this before, I'm sure. So here's our Lifeline page, and here's the Veterans page. If you look at the upper right-hand corner, it says Live 24/7 Veterans Chat Service. The red, click for confidential veterans chat. We also have a confidential homeless veterans chat service. We don't get so many people that come into that, but still people come in, and they write to us from libraries, and they say, I'm homeless, and I need some I need to find a way I need to find a place to stay next week, or in the next week or so, and then we can connect them perhaps with a point of contact at their local VA who specifically looks at homelessness. We have a brand spanking new self-check quiz, and I'm going to be speaking much more about that at the end of the month, but this is a brief online quiz that we're collaborating with AFSP and Lifeline to have people take the self-check quiz and then come on to chat. So again, I'll speak more on that. But anytime, at any point, people can click on that red box and go into the confidential veterans chat service. Next slide. Here is what it looks like for our when the visitor comes in. So here we had to add this whole sometimes technical issues cause a chat to end unexpectedly. Of course, we always can have server issues and software issues, and that's just the fun of chat. But if this happens, please come back to chat again or call us at our phone number. And then welcome to Veterans Chat. Regina will be right with you, and right there where it says Hi Gina, that's where the veteran is writing in. As you can see in the right-hand side of there, we have the Suicide Prevention Lifeline number, and that's up all the time. Next slide, please. So chat statistics for us from July 2009 to June 2011 to this past month, we've had over 20,000 visitors, and we've had over 18,000 real visitors. Those are the people that don't that actually stay on and chat with one of our responders. So about 20,000 people have come into the chat and said, seen the thing that says, oh, hey, what's up, how can I help you? 18,000 of those have written back, and then there's been more of a quality chat. So we've had a lot of people come in. Out of those, it's usually about 10% are referred to the hotline, and so those are the veterans who actually give us their phone number, and we are then able to give them a call. We really, this isn't a referral service to the hotline, the chat service, but when there is someone who we feel may be at higher risk, we certainly want to have a better assessment of them, and that can be best done on the phone, where we can hear the affect, we can hear how intoxicated someone might be. We can really get a better audio sense of how they're doing. We do get a lot of non-veterans who come into our chat service, and until all of you start up your own chat services, which I know many of you are, a lot of our non-veterans are coming to us because they are so desperate to use this medium to reach out for help. So this is where our lovely backup centers come in, and so we're able to then refer them to these backup centers, who are then able to provide them with information that we may not be able to provide them with, just as we're able to provide veterans with information that you all may not be able to provide. And out of those 18,000 or so real visitors, about 8,400 have discussed suicide. So again, a high-risk group. And my last slide before we go to Nikki and Jessica and then questions is I wanted to just give you very specific directions on how to transfer to us. All of you have access to what's called our warm transfer line, and if you forget that number or if you misplace it but you still want to transfer someone over, then just call the 1-800 number and press 1, okay? So while you're on the phone with a veteran, we would want you to call our line, and there's the phone number. And we all want you to say, this is this is Jim, and I work for the San Diego Crisis Line, or wherever you are, and say that you want to transfer a veteran to the crisis line. Don't hang up. And I'm sure that you all know this because you work on crisis lines, but we can't, then if you hang up, then the only phone number that we have listed is your phone number from the crisis center, and that's not helpful if we suddenly lose contact with a caller that we're really concerned about. So before you hang up, please then give us the veteran's name, the veteran's phone number, and if you happen to know what's called their last four, their social security number. Most veterans, there's a culture in VA where veterans will call and say, yeah, this is Jim Smith, 7582. That's the last four of their social security number, and that's what always gets, they're immediately able to go into their records as like S7582, Smith 7582. So if you happen to know those last four, that could be really, really helpful for us. And if you happen to know the veteran's location, this person is calling from downtown Minneapolis or, Fairbanks. And then make sure that the caller is connected to one of our responders, and then you can hang up. So that's how to transfer to the Veterans Crisis Line. I'm always interested to hear how that goes, and as well, Jan Kemp, who is the head of all of this, is always interested to hear how that transfer goes. We really want to maintain our collaboration with all of you, and work together on that. And last slide is my email and my phone number, and I feel a little out of breath, and I feel very alone not hearing anybody's reaction to anything. So let's get a little reaction.
Thanks so much, Caitlin. We're just gonna I'm gonna do one little piece on what's available on the Member Center section, and then we're gonna open it up for Q&A for Caitlin and the Lifeline staff. But you did a great job. Thanks, Caitlin.
My pleasure. Thank you.
So just as a reminder, on the Member Center section of our Lifeline website, we do have in-call resources for veterans. We call it the Veterans Tip Sheet. And this is just a screenshot of what that section looks like. If you go in the in-call resources, you can find it. It's the third one down. And it has some basic questions that will help you if you do discover that you have an active duty or a veteran on the phone with you, and some information that may help you while you're talking to them. On the side, you also see that we have the transfer numbers listed, as well as Jen Kemp's fax number and emails for you and links for you if you need them and a quick notice. So hopefully this will help you as you go through this. We've recently updated it with checking in with backup centers to make sure we weren't overlooking any questions that they often get asked, and know that these are pretty much the basic questions that you may encounter when working with a veteran or active duty member. And then finally, we just want to close by leaving Jessica's and my information in case you have any questions about how to get into the Member Center section, questions about the information that's on there. We're happy to help answer any of that. Now we just want to spend the last 15 minutes opening it up to you guys, letting you ask us questions about anything that might have come up with active duty and some of the questions that Caitlin posed as well.
The conference is now in talk mode.
So does anybody have any questions? Are your numbers similar to what Caitlin presented earlier?
I have a totally different question, if that's okay.
Yes, please.
This is Marcia Epstein at Headquarters Counseling Center in Lawrence, Kansas. One of the things that Caitlin said that surprised me, and perhaps we'll talk about this as a broad issue at the conference. It's not specific to veterans, but she referred to following the Lifeline model related to talking to people who make calls repeatedly to the center, and how that model is 10 minutes once a week at the Canandaigua Center, but that basically that she doesn't believe it's helpful for people to use a line repeatedly. And honestly, that's very different than the approach of our center, particularly in a state where mental health services are very, very limited. So I don't know if she really meant a certain kind of call, but I also was concerned that it was, that she said that's the Lifeline model. So I would like to hear more about that.
Absolutely, Marcia. Thank you for bringing that up. Yeah, I didn't. We certainly shaped it very, very specifically for our line. With the numbers of calls that we've been getting, we really have to. We certainly. And I think that this, and I think that you really hit the nail on the head, which is with the difference between those who are not able to get services and those who are able to get better services. For our repeat callers, for those who are just not in crisis, when we have the numbers that we have, and we've had callers who have called us 3,000 times a month, we need to really make sure that we limit the amount that they call because of how large our staff is. And this is, repeat caller issues are just so huge, and so I'm looking forward to talking about that more at the end of the month too. But for us, we found that it isn't that when we start limiting these calls, and in the one time for 10 minutes at a time, that is also kind of our as usual, but we can kind of mold it to the specific caller using their treatment team. And We're at 6856. Oh, I saw someone. So we're able to do that, and what has been found is that for those callers who have been better shaped by that call, have been reaching out more to their local services. And so we follow that up, we track it, and yeah. So I didn't mean to imply that that's the Lifeline way at all. But we used some of Lifeline's recommendations while in shaping our own repeat caller protocol.
That helps a lot. Thanks a lot for your clarification.
Oh, no problem. Thank you.
And Marcia, if you have any questions, I'm sure Karen can help answer those at the conference that's coming up and can kind of help to provide more info and tips on what the Lifeline recommends.
Thanks.
Any other questions or experiences that your centers may have come up with or experienced?
I just have a question. This is Allie from Peninsula in Knoxville, Tennessee. We just had an incident with a veteran that went to the hospital, one of our local hospitals, and we were never called. The gentleman became agitated at the hospital. Instead of calling us before he became agitated, they called the police, and the gentleman went to jail. And he was a veteran, and he was having some PTSD. And he went there for help. Is there any education that's going on for the local hospitals about what needs to happen? I mean, I can go do it myself and plan to go do it, but I'm thinking there needs to be more than this from the VA maybe or something.
So it's, just so I understand better, so this was a local non-VA hospital?
Yes.
Got it. Yeah, and yeah, that is definitely a concern. Trying to teach people about the real specific issues surrounding veterans, including PTSD and more aggressive behavior, especially if flashbacks occur. That is a problem. What I would recommend, and I can do this offline with you, is I can connect you with the local suicide prevention coordinator in your area, and he or she would be a great resource, and they do outreach. That's one of their requirements besides the tracking and besides their working with us in the crisis line. Then they also are required to do outreach at various places, and it sounds like this might be a perfect opportunity to do that. So please email me, and I'll get you that information.
I will definitely do so. I mean, that was, when I seen this, I thought how fortuitous that this happened this week, and it was very upsetting.
I can imagine. It sounds like it. Yeah.
Okay. I'm still on. Could you put that last slide up that has the email address? Because I didn't copy that. Or is it going to be on there where I can get this presentation later?
It should be back up now. You should see it now.
I have a question. I'm Mary Smith from Greenville, North Carolina, and we're in the middle of about 5 different bases, and so we talk to a lot of veterans either through the line or from directly. And is there a list of these suicide prevention coordinators somewhere that we can get a hold of, a list of their names and that sort of thing, or is that something that we'd have to get privately?
Yeah, Jessica, Nikki, aren't they right on the Lifeline website?
They are. They're under the Veterans page. So if you go under the Veterans page, there's a resource locator, and so you can find by zip code or your state.
Okay.
So it's similar to our Crisis Center locator in that regard. But that's publicly available, so you could access it at your leisure.
Okay, we probably need to get that.
And I think that brings up a good point, Mary. It is everybody, if you can, if you have a moment, your SPC, your local SPC would be a wonderful resource just to kind of get in touch with them and say, hey, I'm out here doing this sort of thing too. I'm working with Lifeline. I work with the National Veterans Crisis Line, and you can kind of help do outreach together, especially if you're in a place like Mary, like you are, where you're really surrounded by a lot of soldiers members and veterans.
Mm-hmm. We have done a lot, well, not so much recently, but in recent years, we've had a lot of cross-training and that kind of stuff that's gone on with some of the pieces of the people in the bases, so we have some contacts.
That's fantastic. That's great. Keep it up.
Thanks.
Well, any other questions as we wrap up the hour?
I have a question. My name is Carl from Milwaukee, Wisconsin. The Suicide Prevention Coordinator, is this a 24-hour contact, or is that 24/7, or is that just...
Yeah, the SPC is business hours only. So try to call them, but they will probably, get back to you pretty quickly. The Veterans Crisis Line, of course, is 24/7, but then the SPCs they work a normal business day.
Okay, well, thank you all for joining us, and thanks, Caitlin, so much for taking time out of your day to share with us all this information. Our information is available. Please email us if you have any questions. And the webinar has been recorded, so if for some reason someone at your center wasn't able to attend and you want to share this information, it will be posted under our Members Center section under webinars. And again, we just appreciate you taking time to visit with us and hear what we had to say.
Thank you so much. And I just want to let everybody know, please contact me if anything comes up. If you have any other questions, I'm pretty accessible. And again, really looking forward to meeting all of you at the end of the month.